Well, it's also analysis paralysis. You might get better coverage for dental or more money back from physio, but then you're like, which one costs more? How many will I use? Will I actually remember to use all of them? And that stuff becomes so stifling that you just end up giving up, right? Like I probably use the most out of our house. Definitely dental, definitely physio and chiropractor and that kind of stuff. But there's a lot that now I have taken off the list because I don't use them or need them.
The Get Rich Slow Club podcast is a collaboration between Tash Etchman from Tash Invest and Ana Christina from Perla. The Get Rich Slow Club acknowledges the traditional custodians of the land we record on. From coast to coast, across land, waters, and communities, we pay our respects to elders past, present, and emerging. Any advice is general and does not consider your financial situation, needs, or objectives, so consider whether it's appropriate for you.
Welcome to the Get Rich Slow Club podcast,
where we take you from beginner to confident investor,
where we can teach you everything you need to know about investing.
So come get rich slow with us.
Hello and welcome back to part 2 of our health insurance episodes. We did one already on what is private health insurance, a bit of a history of Medicare, which was fun to dive into. And now Anna's going to share today her journey of actually changing policies and deep diving into her private health and trying to save money and how much she's spending, which I'm very excited for. But first, money wins, money losses.
Yeah. So I guess the big money win is, because this makes sense, we're talking about healthcare, is that I guess in a way I'm saving $250 for healthcare.
A year, a month?
A year.
Yeah, nice.
So it's not a lot, but that's because I was on a cheaper option and I've upgraded. So to clarify, I'm not saving the money technically because I'm upgrading, but had I stayed with the same company that I was with and stayed with their upgraded policy, it would be around $250 more. But because I swapped companies, I would be saving $250. Okay. Does that make sense?
Yes. We'll get into specifics.
Yes.
But yes, you saved money. I think you can still say you saved money.
Yeah. I think so, because had I just been I'm going to upgrade because I'm too lazy to shop around, I would have paid an extra $250 a year.
Amazing.
So yeah, upgrade. It's going to cost me more, but still, nonetheless, it's saved.
Saved by switching.
Yes, exactly.
Yes. Mine, I don't know whether it's a win or a loss, but beach parking in Melbourne is expensive. It's like $7 an hour.
Yeah.
So I went to the beach and it was lovely, and I love that it's warm weather still in April, but it was $7.
Oh yeah, that's very expensive. Yeah. There's no way to transit out, but I guess transit is also expensive.
No, there's not where Yeah. You can if I did, I'd have to walk to the train station and go to a completely different beach. So it would take me half an hour to get to if I got the train or something. But if I drive, I'm just there in 10 minutes.
Oh, so brutal, so expensive.
Compared to Perth, but that's okay.
Wah, wah. It was not Perth. Welcome to Melbourne and our beautiful beaches here.
Yes. Oh well. I want to get your thoughts on private health insurance just generally before we dive into your numbers and the exact process and your thoughts and everything. But what do you think about private health insurance in Australia's healthcare system?
So I get asked this all the time because I come from Canada where it's very public. It is very, very public. Yes, we have some private healthcare, but that's only through your employer. So for example, you have an employer and they might hook you up for, dental and glasses, but it's not a whole hospital system.
Oh, so your private health insurance in Canada is for extras?
Yes, essentially.
Oh, yeah. Interesting. So there's no private hospital system?
No.
Crazy.
No. So coming here, everyone's oh, our system's Canadian. It's no, it's not. It's kind of American and Canadian put together.
Yeah, it's a blend.
Yeah, it's a blend of those two. So it took me a long time to wrap my head around it. Because when I came here, I guess I was on travel insurance, right? And so when I became a permanent resident, they're in order to become a permanent resident, you have to have private health insurance. So that's when I dove deep into what does that actually mean.
Mm-hmm. So what made you think about wanting to kind of review your health insurance? What sparked this?
Yeah, most recently, it's been on the to-do list forever. And we've been quite good in our house to renew our insurance every year. On the year, we look it up. So we always look for cheaper car insurance, cheaper house insurance. And health insurance, because that kind of just felt, how my partner and I kind of divide and conquer. Health insurance has been in my bucket for so long, and it's just been on the bottom of the list. So it's been years. Actually, my second child wasn't even born since we redid our health insurance. And I knew that I wanted to upgrade because we had the basics. So I knew I needed better coverage, or I wanted better coverage for our family. We're getting older. And I just was it's just in the too hard basket, but it doesn't have to be.
No. Why did you upgrade? Did you ever think about getting rid of it? I know you had to get it to be a permanent resident, but did you ever think, oh, wow, I actually don't want private health insurance?
Yeah, I got rid of it at one point. So,
okay.
Yeah. So this is the interesting part is I had to have private healthcare while I was a permanent resident. And then I needed to have it to be on the visa, on like a bridging visa to be here. So I needed private healthcare for that. But when I became a permanent resident, I didn't need to have it, I think.
Okay.
And I was making under the income threshold. And I thought, is it really worth it for me to have it? Yes, I'm over 31 at the time, but I'm like, is it worth it? And I remember running the numbers and being like, I would save more money at the time by just not having it. So I got rid of it. But now that I have it, I'm getting dinged for the lifetime health cover, the LHC.
So how many years didn't you have it after 31?
I think like maybe 2 years.
Okay. And is it lifetime health cover? Is that what it is? LHC?
Yeah, lifetime health cover. Yeah. So I now pay about $20 a month because of it, because I didn't have it. Not forever. So you have to have 10 years of consecutive private healthcare for it to get removed. So I think I'm maybe year 7 or something like that.
Reflecting back, do you think it was worth it by saving money then? Or do you think it would have saved you more if you just gotten private health and avoided this lifetime health cover?
Yeah. I guess like I didn't anticipate having a family. I didn't anticipate, a bunch of different things. So I probably would have just got the cheapest one at the time just to have it covered. But, I learned from my mistakes. Yes. Hindsight 2020.
What made you decide to want to get private health and cover?
Again, I think it was income. So I was over the threshold again. So I was a higher income earner in the sense that I was over the threshold. So it made sense for me to get at least some kind of basic coverage, which is what I did. I was like, I'll get basic coverage. I used dental and physio and that kind of stuff. I still had birth in a public hospital. So I didn't utilize that because I ran the numbers and it's actually more expensive in a lot of cases to do private, to give birth privately, but this is a personal choice of mine. Very frugal in some ways, as you can tell, being like,
can't spend $5,000 on excess to give birth.
Yeah. So nonetheless, it made sense to be back on it with a family, but I decided on the basic stuff because we're quite healthy and didn't really need a bunch of different things. And then as you have a family and you realize like so many little things come up, like my kid had surgery in the public system. There's a couple other things that have come up where I'm like, it would just be nice to have options. Previously, I had endometriosis and I had surgery at that time and I had to pay out of pocket because it was actually during that time where I didn't have private healthcare.
Oh, you had to pay out of pocket for endometriosis surgery?
Because I did it privately.
Oh, was the wait list too long?
Yeah, it was like over a year. Yeah.
Crazy. How much did you pay for it? Do you remember?
I think it was like 12,000. It was a lot of money. It was like a lot of money.
I've heard of other people who have endometriosis and they've like the wait list have been 2 years or something. So they've gone and gotten private health insurance, waited the year and then gotten surgery still quicker than waiting for the public system, which is crazy.
And at that time, because it was before I had kids, I wanted to freeze my eggs. I was on a time limit, right? Like I wanted to freeze my eggs. I wanted to get like the endo sorted so that I could potentially move forward with like my fertility plan, for lack of a better word, right? And so I paid out of pocket. Luckily, I had that money at that time, and a lot of people dip into their super. But anyhow, had I had private healthcare,
maybe it would have been covered.
Maybe it would have been covered. But the thing is also for a lot of the fertility stuff, you have to have 12 months of waiting. So you have to have that waiting period. So if you're thinking about having kids, or if you want to freeze your eggs or have endo surgery, anything that has to do with that, it's important to get private healthcare a good 12 months prior to thinking about that so you can get that covered.
Even like people wanting to get Invisalign these days, like orthodontists, you have to wait 12 months as well. All that has time limits on it.
Yeah. The cool thing that I learned going through this process, so obviously I wanted to switch my plan. I saw Molly from Ladies Finance Club talking about how she swapped over. She used a company called Choicey. I was like, hey, I love what Molly does. I actually used a comparison company a few years ago when I got the really basic plan and was like, hey, like, let's go through this process. And it was so easy. I actually was like, why was I holding off for so long?
I think about everything that I put off forever and then it takes me half an hour and I'm like, oh, well.
I just jumped on a call with them. It was like a half an hour call and they were like, what do you currently have? Who are you with? What are you looking for? Right. And I was like, well, I just want to have better coverage for hospital because you never know when your kids.
What do you mean by better coverage? Like you want to just cover more things?
Yeah,
or?
for the hospital. Yeah, for hospitals and stuff. So I had really kind of basic stuff, but if I have to do endo surgery again in the future, I want to be able to be covered for that. If my kids have some kind of surgery that they need to have because they're kids and they break things and who knows what, I want to be able to be covered for a choice there. I think for me, it's really important to be able to choose your doctor. And I'm going to be honest, like I hate that I have to that we have a system where if you have money and if you have coverage, you can pick your doctors, whereas the public system's so long and you have to wait so long to actually. That's the hardest part. And the more you kind of look into policy and essentially how things are set up, it's set up to be privatized in order to often kind of gut the public system that we all pay into. And that's the hard part about paying for this stuff because...
Yes, actually, a question I got on Instagram was someone saying, is it actually unethical to get private health insurance because you're supporting the system that's trying to gut the public health system?
Yeah, that's the hard part.
How do you feel about that?
Well, I always have like these ethical kind of issues around these things, right? It's just like, it's black and white. The thing is, if I do have more money and if I can pay for private healthcare, it does make sense to take the load off of the public system for people who might not be able to afford it, right? They have less choice. They have to maybe wait longer. But I wish we could just change the system. So I don't know if I'm actually contributing to the system by having to pay for that in the ethical sense. I think it's more important of, can we find politicians and policy to support the future that we want for ourselves, for our kids, and for society as a whole.
Yeah, and you have to put yourself first. Like, you can't be advocating for policy changes if you're the one who is really unwell and you don't have like the time and space and energy to even deal with that kind of stuff. So there is almost like a selfishness to it of like, I need to look after myself first and take like advantage of the system we have now. And then sure, we can try and advocate for more stuff. But it's a hard one if you think about it for too long and you're like, what is the way forward?
It is really hard. And I have a friend right now who's going through cancer and I'm seeing how much it's costing her.
Yes.
Whereas I have family members in Canada who've gone through cancer and they have it's free. Everything is free, absolutely free.
Yeah, it is. I was really surprised like hearing about a friend whose mum went through it as well. Just like the cost of like scans out of pocket. And like, if you want to not wait all day, you have to just go and get it privately or they'll just send you somewhere else because that one's closed or too full. And that's just crazy thinking about having to navigate that while you're really unwell.
Yeah. Whereas in Canada, in Vancouver, we have one of the best cancer centers. So everything is done through them and everything is free. All your scans, all your calls, all your nurse visits. Like, why is that system not here? And
is hospital parking free in Canada?
No, hell no.
Okay, that's a pet hate of mine.
But I rather pay for parking and have good free public healthcare. So it's hard, and that's why I feel sometimes like angry that I have to pay for private healthcare. But unless we are changing the systems that we have in place, and the previous episode that we did on healthcare, like we talked about how politically charged it was, even just getting it in place, right? Having a Medicare system.
And it makes sense because if people are accessing services earlier, they cost the government less over their lifetime because we can prevent all these things. Well, not all these things. We can prevent a lot from happening. So it's like a kind of backwards way to be like, oh, we'll just deal with it later when people are ill rather than preventing things now.
Yeah. So back to the ethical question. I mean, everything is gray, right? Like, Can we change the systems that are not helping and supporting the most vulnerable in our community? And I would love to change those things.
Yeah. And we can't get too bogged down because we could sit here and debate the ethical stuff forever and not do anything. You still have to do what's best for you as well and take care of your family.
Which is why I got private healthcare.
In summary.
It's so hard. Yeah.
So how did you decide what you wanted? You jumped on the call?
Yeah, the call was amazing.
Did you make a list beforehand of like, this is what I want? Or did you just go in and you're like, I'll see what they say?
No, I was like, I should look at my policy. I don't even remember because it's been a few years now and I needed to update it a long time ago. I was like, what do I even have covered under it? Like, I know I use it for my dental all the time and this and that, but I was like, I don't actually know what the hospital cover is because we've never really used it, but I just want to be prepared. But on the phone, they just asked me all the questions. What do you use? What don't you use? What do you want? Are you looking at like, they asked me all the questions of what I anticipate. And of course we don't know what the future holds and we don't know if we're going to have cancer or have fertility issues or this and that. But I knew like, hey, I'm done having a family. So the fertility stuff is like ticked off. Like I don't need coverage for that. Yes, endo might be a thing. So I just kind of went down the list. Like, do I want stuff for glasses? I had laser eye surgery. So right now I don't, but I'm getting older, so I might need glasses soon. So we just went down the list of all the things. Yes, no, what I want coverage for. And looking at my existing policy, I already knew that it was inadequate. And if I stayed with the company that I was with, I would have been paying $250 approximately more than swapping. And so I swapped over to this other company and it was just, they have like a database. So how it works with these comparison sites is that they usually have a database of all these healthcare providers and they kind of run all of your information through it and kind of spit out, these are the best options for you. And there might be a thing where you're like, I want to go with a not-for-profit private healthcare company. They exist. So if there's an ethical issue around that, you might want to choose that instead. So they can kind of give you the options around that, and then you can choose. So what I found was a better option for me that covered all the things that I needed. And the cool thing that I didn't know, because this is where I'm like, how does this work? Is that loading time, that 12 months that you have to wait, if you're swapping companies, it doesn't start from scratch again.
Yes, because they want you to swap and they don't want to penalize you for swapping. They're like, yes, come to us.
But this is like a government initiative, I think.
Is
yeah.
it?
I might be wrong.
I don't know. I haven't looked into it, but I thought it was a marketing thing.
I don't think it was a marketing thing. I think it's essentially like a way to make it more competitive and that you can actually find a private healthcare provider that suits your needs instead of having to have that.
We love that. Oh, actually, I did find it. So this is on the government website. If you change policies or insurers, health insurers must not give you extra waiting periods if you switch to a new policy that offers the same level of benefits as your old policy. This even applies if you change insurer. So maybe if you're getting more cover, they can give you a waiting period, but they might waive it anyway.
If it's new, yeah. If it's new. So for example, let's say I do want some kind of support with fertility and birth, and that's new to my coverage, then yes, I have to wait for that loading period because that's a new added thing to my policy. However, if I had it covered before, I don't have to wait the 12 months or a loading period, which is lovely, right? Because I don't think that's always the case in every industry, right? So this is a really great way to just swap policies.
Yeah,
if you need to. Yeah, you're not stuck. You're not like, oh, I have to wait another 12 months for fertility stuff.
Did you get a few good options come back, or was there one that stood out as the cheapest?
Yeah, there was one that stood out that's cheapest. There was a not-for-profit one as well that I kind of looked at, but it didn't give me as much, like I didn't get as much money back for like physio and dental and whatnot. So some of the extras was not as adequate. So
how did you decide on like the excess amount for hospital cover? Did you pick an excess amount? Was it like I picked $100 or $250?
I think they had a standard one and I was happy with that. So I kind of just went with that. I think when it comes to house insurance and stuff, we run the numbers in our house of what we're happy to pay out of pocket.
Yeah.
But I think here I was just like, oh, that's fine.
Yeah. I usually pick the higher excess because I haven't had to claim on insurance very often. And I know that I have like that and an emergency fund to pay even for travel insurance and stuff. So I guess it's the same with private health. You pick what you think you could afford in that moment.
Exactly. And then the provider that I'm with now, because I'm going on a trip soon, also has travel insurance and you get like 10% off or something. So I was like, fun. Oh, good. I'll look into that as well. Right. Because I'm already under their banner. It just makes it easier. So that was that. So I was pretty happy. It was like a half an hour phone call, came back with a couple with a policy specific that was best for me. I sent it to my partner in a PDF to kind of look it over. And then I said, okay. And I didn't have to do anything. They moved that all over for me. That. So I didn't, they said, hey, sometimes your old provider will call you up and try to stifle your move over or get you to stay, but just don't respond. We'll get it all done. So it all just happened easily with ease and I didn't have to worry about it at all.
And this isn't an ad for Choicey, just to clarify, just something you saw.
Oh
online.
Yeah, sorry. Yeah, I should clarify.
Did you try any of like the other comparison websites just like online? Or you just did the call with Choicey?
I just did the call with Choicey. I've done comparison ones before. And I know that sometimes they don't cover every private healthcare provider out there, which is unfortunately, like it would be great to see everyone. But this sometimes it's like the least resistance just to get it done. Like this is better than before. Could it be better had I had more time? Maybe I'd dive deeper into all of the comparisons, but I was just like, I just want to get it done. And it's really important to be thinking about these things because as the end of financial year comes, you want to be thinking about what am I going to be making in the new year? What am I making in the old year? This is the best time to be looking at that stuff, as it is with a couple other things, right? Like investing in your super or healthcare. Like all those things are really important when it comes to end of financial year. So doing it right now is a really great time to do it.
And there's so many marketing things. I see like private health insurance, you can sometimes earn Qantas points or velocity points for signing up to new policies, which could be fun if you want to like hack the system. But yeah, it's like it does take a lot of time to compare benefits, or some of them offer like 50% off gym memberships and stuff like that. So it can feel like a lot if you're like, oh, that one's a little bit more expensive, but I can get a cheaper gym membership and maybe some Qantas points or something. So it's hard to balance everything unless you're just like, no, I'm saving money. I'm just going to move and be done with it.
It's also analysis paralysis. You might get better coverage for dental or more money back from physio, but then you're like, which one costs more? How many will I use? Will I actually remember to use all of them? And that stuff becomes so stifling that you just end up giving up, right?
Do you use your extras?
I use some, yeah. I probably use them most out of the house, like out of our house. Definitely dental, definitely physio and chiropractor and that kind of stuff. But there's a lot that now I have taken off the list because I don't use them or need them.
Do you have ambulance cover as well?
Yes. Yeah. So that was covered under this as well. I know you can get ambulance coverage independently of a private healthcare.
I thought it's
so
something like $50. I think in WA, I don't know the other states because it's state by state, but I think you can just get it for $50 for the year. I'll have to check the updated prices, but it's pretty affordable.
I think it was for Victoria as well, because at one point I did that when I wasn't getting private healthcare.
Yes.
But yeah, it's quite cheap, but this gets covered under that as well. So you don't have to worry about it.
Amazing. Any last tips, words of wisdom for people who are thinking about looking into their health insurance? They're feeling a bit overwhelmed, don't know where to start, what to look at?
Well, one of the best things that you can do is just talk to a comparison website. They can kind of walk you through it, give you a couple options. You don't have to sign up if you don't want to. You can just see what options they've given you, and then you can do your own comparison as well. So there's ways to go about that. You might want to do the spreadsheet. Surely Reddit has a spreadsheet of different private healthcare providers, but this is just a good thing to do. The thing is, think about it, put it on your to-do list and do it annually, especially before the next financial year, especially if you know what your income is going to be, if you're right at that like threshold of, especially if you're over $93,000 a year income.
And check that every year because that changes as well.
That changes as well, or 186 for a couple family at time of recording. It's just important to look into that, but put it on the to-do list. I don't know, we're so good at house and car insurance, but this one has we've had the same one for 4 years, and really we probably could have been saving money faster.
Yeah. And it's always one of those things that you're like, oh no, that won't happen to me yet. It'll happen to me later maybe. Well, that's like a later problem, but you never know when these things will pop up.
You never know. You never know. So just get it done. Put it on the list. Let us know if you've done it because it's awesome.
Okay. Yay. Bye.
Bye.
Thanks so much for joining us. If you found this episode helpful, please rate us 5 stars, write a review, or share with a friend. If you're new to investing, make sure to listen to our first 10 episodes. Follow us at Get Rich Slow Club or Tash at Tash Invest or me at Ana Cristina.
This show was brought to you by Natasha Etchman, who is an authorized representative 1299881 of Guideway Financial Services, AFSL 420367, and Perla, who is an authorized representative 1281540 of Sanlam Private Wealth, AFSL 337927. Knowledge is power, especially when it comes to investing. So make sure you check out our financial services guides and read the product disclosure statement and target market determination for any investments you're considering. See our show notes for more info.